Hey.
Not there, here.
In today's video, we're gonna talk about, this is a video, babe.
Oh, today's video we're gonna be, hold on, Mia, stop. So in today's video, we're gonna just be talking about some tips that we can give y'all as new grads, as we're finally by ourselves on the floor as ICU residents.
Real quick and dirty, so.
Oh, not residents, scratch that. We're actually on our own now, so ICU nurses. Full tips for y'all to take note of and so y'all can survive.
All right, stay tuned.
Peace.
We got 1% battery.
Hey guys, welcome to A Couple Nurses. It's been a long time. We just wanted to share some quick tips on you now that
long, days.
For me, I haven't been in one in a while, so we wanted to just share a few tips that we came up for y'all now that we're finally on our own as brand new graduates straight out the womb. We wanted to just talk about having some courage, talking to doctors.
In the ICU.
In the ICU, all of these starting for the ICU. As well as, what else you got, Dero?
So we'll run through them all because we only have 1% battery. First part is orientation.
Orientation phase, y'all. Soak it all up as much as you can. You're gonna be getting things thrown at you at 100 miles an hour. Of course, take it all in the pace that you can, but all the information, whether you're a planner, whether you write down notes or do recordings, whatever it is that works for you, treat it like it's nursing school all over, except this time is actually really good information and pertinent that applies to your unit and floor, as well as what you're gonna be doing on a day-to-day basis.
Number 2 is investigation. So whenever you get on to the floor and you receive care from your patient, there's a couple things you need to be looking at. Your labs, you need to look at all your drips, check the vent settings. These are some things that sometimes get lost in report, and somebody may miss the lab, or somebody may have the wrong parameter set for their drip, you know?
Right.
So definitely check the labs, drips, all that stuff, and look into it and see what needs to change, if anything. And
not only that, but with our next topic that we're gonna give you as a helpful tip for y'all, whenever you're investigating further on your patient, when we say that, we mean after you get report and get settled in, give your morning meds, check in a little bit further into what brought them to the hospital, what's their disease process, what other comorbidities they have. That way, whenever you're giving the care that you're getting orders for, you can question those orders. You can see what you can do different. When the doctors come around, it actually seems like you know your patient and you know what you're talking about. So with the next tip that we have is actually talking to the doctors. And with that, we say it's all about how you word it, having the courage, okay? You don't tell them, hey, put this order in. That's not how it works. Kind of make it their idea. I've noticed that with some doctors, they like it when you kind of make it their ideas. And I also have some very chill doctors on my floor that I can just kind of straight up tell them like, hey, this is what's going on. I think maybe we should have this. Always kind of have a recommendation in the back of your mind that actually makes sense.
Real life 𝘼.
Real life 𝘼. Did how it is like during handoff, and it is also legit when you're talking to a doctor. Next.
Self-confidence. So you prepared for this. You have all the resources. Have confidence in yourself as a nurse. Not arrogance.
No.
Right? But be
difference.
confident in what you're doing. Be confident that, you know, this is your patient. You want somebody to be assured of themselves. If somebody's taking care of me, I want you to be sure of the things that you're doing. Don't be doing things. If you're unsure, ask somebody. And the last one is
being coachable, y'all. I cannot stress this enough. Being coachable is key. Like going back on what he said, don't be arrogant, be confident, and there's a very fine line between that. You know, don't go around just kind of knowing it all. Like I said, be coachable, absorb everything that you can. This ties into kind of all the things that we talked about and just discussed right now. Making sure you're asking tons of questions. I've had tons of nurses where they've helped me on these first few days because I needed help on just little, very minute things that I didn't get the chance to experience during orientation. And I even would apologize for asking them for help, and they said, Monica, the time that you stop asking for questions is the time that we're all gonna start getting worried. So I always remember that in the back of my head. Don't be embarrassed to ask questions. Don't be embarrassed to not know anything. Be coachable.
Yeah. That's it. Those are our quick tips for us starting in the ICU, for new people starting in the ICU, whether you're transferring or whether you're a new grad. If you like the video, comment Nurses Rock down the bottom, like, share, subscribe, all that other good stuff. And until next time, peace out.
Bye guys.
Oof.